What if quitting coffee after 60 didn't just change your mornings, but quietly affected your sleep, digestion, and even how certain medications work? Most people expect instant benefits, but the first few days often feel worse, not better. Headaches, fatigue, that foggy feeling. Here's the part many don't realize. Those early symptoms are temporary, and what happens next depends on your age, your habits, and your health. Today, we'll break down what science actually says about stopping coffee after 60, calmly, clearly, and without hype.
When someone over 60 stops drinking coffee, the very first changes usually show up within 12 to 24 hours, and they're often uncomfortable. This phase is called caffeine withdrawal, and it's a real, well-documented physiological response, not a sign that something is wrong. Research shows that regular caffeine use causes the brain to adjust its adenosine receptors, the system involved in sleep pressure and alertness. When caffeine is suddenly removed, adenosine activity temporarily increases, leading to symptoms like headache, fatigue, low energy, irritability, and difficulty concentrating. Studies show these symptoms typically peak around 24 to 48 hours and then gradually improve, usually resolving within 2 to 9 days. For adults over 60, this phase can feel more noticeable. That's partly because sleep patterns, hydration levels, and medication use already affect energy and focus at this age, so a morning without coffee might feel unusually heavy, slower thinking, less motivation, even mild low mood. This doesn't mean coffee was fixing a problem, it simply means the nervous system is recalibrating. Headaches are the most commonly reported symptom. They're linked to changes in blood vessel dilation in the brain once caffeine, a mild vasoconstrictor, is removed. Fatigue is also common, especially in the morning when many people relied on coffee as a cue to feel alert. The key reassurance is this: these effects are temporary. Research consistently shows they fade as the brain adapts. Understanding this upfront helps prevent people from quitting prematurely or assuming coffee is essential for normal function. The discomfort passes, and what happens next is often where meaningful changes begin.
After the initial withdrawal phase passes, many adults over 60 begin to notice some subtle but meaningful improvements within the first few weeks. These changes aren't dramatic overnight transformations, but research suggests they can make daily life feel noticeably easier. One of the most consistent benefits reported is better sleep quality. Caffeine can remain in the body for 6 to 8 hours, and in some older adults, even longer. Studies indicate that aging slows caffeine metabolism, meaning an afternoon or early evening cup may still be affecting the brain at bedtime. When coffee is removed, sleep often becomes less fragmented, with fewer nighttime awakenings and a shorter time to fall asleep. Many people also report feeling more refreshed in the morning, even if total sleep time doesn't increase dramatically. Blood pressure is another area where short-term changes may appear. Research suggests caffeine can cause a temporary rise in blood pressure, especially in people who are sensitive to it or who don't consume it regularly. After stopping coffee, some individuals experience a small reduction in resting blood pressure. This effect tends to be modest, and it doesn't replace medical treatment. But for adults over 60 managing cardiovascular risk, even small improvements can matter. Another commonly overlooked change involves nighttime urination. Caffeine has mild diuretic properties and can also irritate the bladder. For some older adults, especially those already waking at night, stopping coffee may reduce frequent nighttime bathroom trips, leading to more uninterrupted sleep. Importantly, these benefits don't happen to everyone, and they're influenced by timing, dose, and individual sensitivity. Still, research suggests that for many people over 60, the weeks after quitting coffee can bring calmer nights, steadier energy, and more consistent rest, setting the stage for longer-term adjustments.
One of the changes people often notice after stopping coffee, especially within the first 1 to 2 weeks, involves digestion and bowel habits. This can be surprising because coffee is so closely tied to morning routines that its digestive effects often go unnoticed until it's gone. Research shows that coffee stimulates the gastrocolic reflex, a natural response that signals the colon to contract after eating or drinking. This effect happens with both caffeinated and decaffeinated coffee, suggesting that compounds in coffee, not just caffeine, play a role in promoting bowel movements. When coffee is removed, that familiar morning urge may weaken or disappear temporarily. For adults over 60, this change can feel more pronounced. Aging naturally slows gastrointestinal motility, and many people already manage digestion carefully through diet, hydration, or medications. Without coffee's stimulating effect, some individuals experience slower bowel movements, mild constipation, or a feeling of incomplete emptying during the adjustment period. It's important to understand that this doesn't mean digestion is worsening in a harmful way. It's a physiological adjustment, not damage. Studies suggest the gut adapts over time, and bowel regularity often returns as the nervous system and digestive tract recalibrate. Simple, evidence-based strategies can help during this transition. Increasing dietary fiber from fruits, vegetables, and whole grains supports stool bulk and movement. Adequate hydration is equally important, especially since some people unconsciously drink more fluids when coffee was part of their routine. Gentle physical activity, like walking after meals, has also been shown to support healthy bowel function. For most people, these digestive changes are temporary and manageable. The key is to anticipate them, respond calmly, and avoid unnecessary concern. With small adjustments, the digestive system typically finds a new, stable rhythm without coffee.
When people over 60 consider quitting coffee, bone health often comes up, and understandably so. As we age, the risk of osteoporosis and fractures increases, especially for postmenopausal women. The good news is that the science here is more nuanced than many headlines suggest. Research indicates that very high caffeine intake, generally more than 300 to 400 milligrams per day, or roughly 4 or more strong cups of coffee, may be associated with slightly increased calcium loss in urine. Over many years, this could contribute to bone loss in people who already have low calcium intake or other risk factors. However, large observational studies show that moderate coffee consumption, about 1 to 3 cups per day, is usually not strongly linked to higher fracture risk, and in some populations it appears neutral or even mildly protective. For adults over 60, the bigger issue isn't coffee alone, it's context. Adequate calcium and vitamin D intake, regular weight-bearing exercise, and overall nutrition play a far more significant role in maintaining bone strength than whether someone drinks coffee. In fact, research suggests that when calcium intake is sufficient, the potential negative effects of caffeine on bone health are largely minimized. That said, certain groups should be more cautious. Postmenopausal women with osteoporosis, people with a history of fractures, or those with low dietary calcium may benefit from reducing high caffeine intake rather than quitting abruptly. This is especially relevant if coffee replaces meals or interferes with nutrient intake. The takeaway is balance, not fear. Stopping coffee doesn't automatically strengthen bones, and drinking moderate amounts doesn't automatically weaken them. For people over 60, long-term bone health is shaped by daily movement, nutrition, and medical guidance, with coffee being a smaller piece of a much larger picture. One of the most important and often overlooked considerations when stopping coffee after 60 involves medications. Adults in this age group are more likely to take prescription drugs, and caffeine can influence how some of them feel, work, or are tolerated. Because of this, changes in coffee intake can sometimes lead to unexpected effects. Caffeine affects the central nervous system, heart rate, and how certain drugs are metabolized in the liver. When someone regularly consumes coffee, their body adapts to that stimulation. Removing caffeine may alter how medications are experienced, even if the dosage hasn't changed. For example, some people notice increased drowsiness when stopping coffee while taking medications that already have sedating effects, such as certain sleep aids or anti-anxiety medications. There are also documented interactions between caffeine and specific drugs. Research indicates that caffeine can intensify side effects like palpitations, jitteriness, or blood pressure changes when combined with stimulant medications, some asthma treatments, or certain antidepressants. In contrast, stopping caffeine may reduce these symptoms, which can feel positive, but it can also unmask underlying fatigue or low blood pressure in some individuals. Blood thinners, such as warfarin, deserve special mention. Studies suggest caffeine intake may influence clotting factors indirectly or affect how stable blood levels feel in some people. While coffee doesn't usually require complete avoidance, sudden changes in intake, including quitting, can complicate symptom interpretation. This is why gradual changes matter. For adults over 60, it's safer to taper coffee slowly and inform a healthcare provider, especially if managing heart conditions, mood disorders, or chronic illnesses. The goal isn't to create fear, it's to prevent confusion. When coffee intake changes, listening to the body and coordinating with a clinician helps ensure those changes support health rather than disrupt it.
By now, quitting coffee after 60 might sound like a clear win. The headaches fade, sleep often improves, nighttime bathroom trips may decrease. On the surface, it feels like the problem is solved. But here's the twist most people never hear. Large, long-term studies following older adults suggest that moderate coffee drinkers often have lower overall mortality than people who don't drink coffee at all. Some research also links coffee to lower risk of conditions like Parkinson's disease and type 2 diabetes. These findings don't mean coffee is a cure, but they do challenge the idea that stopping is automatically better. So why do some people feel noticeably better without coffee while others seem to benefit from it? The answer lies in individual response. As we age, caffeine metabolism slows, sleep becomes more fragile, and medications become part of daily life. The same coffee that once felt energizing can quietly interfere, or it can still be well tolerated. This is the moment where most advice gets it wrong. The real question isn't, should you quit coffee? It's how to use science to decide what works for your body after 60.
And that insight is coming next.
The most evidence-based approach after 60 isn't quitting coffee for everyone, it's personalizing intake. Research suggests that if coffee disrupts sleep, worsens anxiety, raises heart symptoms, or interferes with medications, reducing or stopping it gradually may help. But if you tolerate coffee well and drink moderate amounts, about 1 to 3 cups earlier in the day, there's little evidence you must quit. The safest strategy is a slow taper, not abrupt stopping, and a quick check with your doctor if you take long-term medications. Start by observing your habits for 1 week, how much coffee you drink, when you drink it, and how it affects sleep, digestion, or heart symptoms. Next, taper slowly, reducing intake by about 25% every 3 to 4 days, or replacing 1 cup with half caffeinated or decaf to minimize withdrawal. Finally, replace wisely. Keep coffee earlier in the day, stay well hydrated, and support bone health with adequate calcium, vitamin D, and daily movement. To recap, stopping coffee after 60 can cause short-term withdrawal, but those effects usually pass. Many people notice better sleep and steadier energy within weeks, while long-term health depends more on overall habits than coffee alone. The key is listening to your body and making gradual, informed changes. If you're unsure, a brief conversation with your doctor can add clarity. If this helped you think differently about coffee and aging, subscribe for more calm, science-backed health guidance and share your experience in the comments.